We're back with today's checklist and some important information for American Heart Month. Last month's numbers from the American Heart Association reveal more than 130 million U.S. adults are living with some form of heart disease. So this morning, we're going to break down some ways to improve our heart health with Dr. Jennifer Haythe. She's a cardiologist at New York Presbyterian Hospital, Columbia University. Good morning. Welcome back, Dr. Haythe.
Good morning. Thanks for having me.
So again, according to the American Heart Association, this continues to be the #1 cause of death in this country, but there are ways that we can protect ourselves.
That's
what
true.
are some of those ways?
So I think the first thing we should talk about is prevention.
Yeah.
So prevention can come in many forms, but one thing to do is to take care of your modifiable risk factors. Control your blood pressure, control your cholesterol. Also, something new we have is personalized genetic screening. So there are a number of heart problems that are caused by genetic abnormalities, and family history might bring that to light. This can sometimes be expensive, though, and not always covered by insurance, so it may or may not be available to all people, depending on your insurance plan. Avoiding ultra-processed foods. This has gotten a lot of attention lately in the news. I don't think everybody quite realizes that we get about 50% of our calories in this country from ultra-processed foods.
Now, what's the difference between ultra-processed and processed?
So a good rule of thumb is if you can't pronounce the word, it's ultra-processed on the ingredients, right? Okay. So it's like refined sugars, things like chips, cookies, anything that's coming in a package that has a ton of preservatives and additives. So that's something to try to stick to whole foods, real food, not juices. Also move daily. Exercise is key. The GLP-1 inhibitors, so this are agonists. So these are very important drugs. Everybody's heard about them. The Ozempic, Wegovy, Mounjaro, Zepbound. These drugs cause incredible weight loss in some people, and for that, it's great. You know, it curbs your appetite. It actually, causes weight loss. But more importantly, it's been shown to cause a reduction in cardiovascular adverse events by up to 20%.
Wow.
Yeah.
Wow, that's a great number.
Yeah.
Now, so let's talk about what there is beyond you can do beyond diet and exercise. What about wellness and other lifestyle changes? What's the research on that?
Yeah, I mean, the research is always changing here. I think that things come in a little bit of a trend form, but there are a lot of real hard data in these areas. So one important thing is to feed your gut healthy food. So this also gets back into the ultra-processed situation. So yogurts, especially yogurts that are not highly processed, have great bacteria in them that help heal your gut. And our microbiome in our gut is really a cause of inflammation if it's not well regulated. And we know that inflammation is very much linked to heart disease, especially when you linking to our next topic, prioritizing oral health. So for many, many years, we've known that poor dentition, gingivitis is linked to heart disease, possibly through inflammation. Also, when you have bad dental care, you get bacteria in your bloodstream, and that can cause infections in your heart and high levels of inflammation that lead to coronary artery disease. Finally, sleep. So this was added to the Life's 8, according to the AHA. Sleep is so important. There have been studies where they looked at people who go to sleep at a regular bedtime and ultra late. People who go to sleep after 2 a.m. and wake up late are shown to have a much higher prevalence of high risk factors for heart disease.
As a woman with heart disease, like running rampant in my family, I worry because I hear that some women are more impacted by heart disease than others. Why is that?
Well, a lot of women are impacted. It's actually the #1 cause of death, more than all causes of cancer combined. The important thing I know most people don't know that, right? The most important thing to realize is that about 45% of women over the age of 20 have a risk factor for cardiovascular disease or are living with cardiovascular disease. Women are often not attended to properly. They haven't been in the randomized trials the right way. They don't always have doctors that are paying attention to their risk factors. So women really have to advocate for themselves. We've done a lot of education in this. We're trying to turn this around. It's always been thought of as a man's disease, but it really isn't. So you need to be an advocate for yourself.
Okay.
Dr. Haythe, great tips. Thank you.
Thank you.
Thank you so much.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.